Hi ladies, it's Lisa, and I had a hysterectomy 2 weeks ago, and I just wanted to let you know a few things that they don't tell you before and right after. So, take you back a little bit on my history. I had breast cancer in 2015, so I had a complete hysterectomy, including tubes and ovaries, due to the side effects of chemo. So, that's a whole other story. So don't throw away all of your pads, and buy some panty liners for after surgery, because your bladder, it could take some adjusting. So sometimes you leak after you pee, like you go to stand up and some dribbles out, or if you cough, if you sneeze, sometimes it dribbles out too. So it's really good just to have a panty liner on for that. So my surgery was with the Da Vinci, and it was just through just a few small incisions in the abdomen, and then all of the organs were just like delivered through the vagina. So no open abdomen. So it was, in my opinion, a pretty easy surgery. When I first woke up, I had severe back pain on the left side, which I thought was from my previous injuries I have in my back, some herniated discs and a bunch of other stuff. But the doctor explained to me that it was from when they removed the uterus, that they cut from the ligaments in your back. So that's what all the back pain was from, and it was awful, just awful. So right after surgery, that hurt. I kept hitting the button for the pain medicine, and I slept off and on. I don't remember very much at all, but when I finally came around, I was drinking water, eating chicken broth, and I only felt nauseated one time. It was the first time I got up to actually go pee, and I think it was a lot of anxiety just sitting there and nothing was happening. So your first pee after surgery, just really, really relax, drop your jaw, let your body fully relax, and you'll pee. But it didn't hurt at all. It didn't burn. I had very, very little bleeding for the first few hours after surgery. Like, just in a panty liner was good enough for it. I put my own underwear on and no pad after like the first 12 hours. So I never bled again, and it's been 2 weeks. No pain from surgery. No, there was a little bit of soreness. The worst part that I had was I had a reaction to the steri strips, which I'm allergic to adhesive anyway. So I had a blister about the size of a quarter that developed around the one steri strip, and the other one started developing. So I pulled all the steri strips off and the Band-Aids, and I healed just fine. But other than that, my doctor and I talked about, do I need to shave the area before surgery? He said no. The first time I went pee, I realized that they shaved me. So I was not very happy about that, because I would have taken care of it myself. So anyway, I got shaved. The first pee, just really, really, really try to relax. Use panty liners after surgery. There is a chance that you could bleed. It's normal if you do, up to a couple weeks, like off and on bleeding. But, if you feel any fever or severe pain or anything, if there's any oozing or blisters around your incision sites, go see your doctor, go to the emergency room if you're short of breath, or, anything like that. So I think it was a great decision. And since my labs were already pre-menopause and post-menopause prior to surgery, I have not had any hot flashes, no mood swings, no crying, nothing like that. So nothing has changed other than I finally stopped bleeding after 3.5 months. So I'm really happy about that. I thought it was a pretty easy surgery. A few days after, I went to a movie and out to dinner with a friend. And I have felt fine. I'm ready to go back to work, and it's been 2 weeks. So I'm going to talk to my doctor and see if we can up it so I can go back to work even sooner. So please leave a comment, or if you have any questions, I'll be happy to answer them for you. And I have lost 10 pounds since surgery. I've been drinking lots and lots of water, taking prenatal vitamins since, after you have your ovaries removed, it stops, your bones get weak and brittle. So I did that, and I drink Slim Fast a couple times a day to up the calcium and the vitamin D. So good luck to you, and please, if you have any questions, just leave me a comment. Thank you.